So like the fact that like we've already talked about access like several times, and
Yeah.
now I get to ask you about this
Yeah.
because the audience, I love when they don't. This is why I didn't want to give them your resume first. I mean, I don't want to say invented. Did you invent, or what was your role with the I'm just going to say this: CVS Minute Clinic. What?
Yeah. So CVS Minute Clinic, I was there for about 8 years, and no, I didn't invent it. A bunch of physicians did about 20 years ago, believe it or not.
Wow.
Very forward thinking. But I loved the disruptive nature. If you think about it, and you're young, and probably a lot of people are young, but back in the day, you either go to the emergency room or you go to your PCP. There was nothing in the middle. And so so when you think about access, right, and you think about, like, I was just so impressed with that concept of doing something that was disruptive and provided options for patients. And by the way, in Minute Clinic, 50% of the patients were seen after traditional physician hours.
Really?
So evenings and weekends. You think about working people. You think about people that have, kids that are in school, et cetera, et cetera. So I loved the disruptive nature and the creating access. Retail health is all about making it easy for patients, making it convenient for patients, and pushing the envelope on whatever you can do so that the provider can just see the patient.
That's why they signed up, right? I mean, that was
Yeah.
the idea why they signed up. But if there's a barrier, so now we go back to obviously, I mean, putting first of all, the marketing on that, just calling it a minute clinic, because one of the things people think of is I'm going to show up, I'm going to have to wait around for a while, it's going to take long, I don't have time, and you put it right in the name. It's a minute clinic.
Yeah. That was the concept, but of course, people would be like, "I had to wait 20 minutes. I thought it was a minute clinic." So it definitely was challenging at times. It worked both ways, but I think that Minute Clinic, we were across almost all the states, and we were located in CVS stores. Well, guess what? Where are CVS stores located? They're located where people live.
People
Right.
shop.
And by the way, they're located where not a lot of people live sometimes, depending. Yep. And so it was a brilliant concept. I can take no credit for it. But it was creating access that was easy, convenient, affordable, and high quality care.